Our first speaker will be Deb Vonner from Nurses Alliance. Thanks for coming, Deb.
Good evening, everyone. I'm a registered nurse, and on a daily basis, I would see patients coming to the hospital. Can't hear.
Here, closer to your mouth.
Good evening. I'm a registered nurse, and on a daily basis, I would see patients coming to the hospital with no health insurance. I saw people who suffered from diabetes and didn't have enough money to buy their medications, who would stub their toe or get a blister, or maybe drop something on their foot and get a little bruise. And that bruise turned into something worse as the days went by. They wouldn't go to a hospital, they wouldn't go to a doctor. They would doctor it themselves at home until it was too late. When they would finally resort and come to an emergency room, that sore would be large, it would be infected, and we would be doing surgery on a weekly basis to try to take care of it. Unfortunately, with diabetes, the healing is really bad, and many times these folks would lose their legs. Then you had someone who could no longer work because they were missing a limb. They didn't have the money to pay for a prosthesis after that, so they would have to resort to a wheelchair if they were lucky enough to get one donated to them. We would see patients who would come to the hospital after having stomach pain or maybe heartburn after eating, and they'd just kind of put up with it at home until it was too bad. And then they would come to the hospital because they couldn't stand the pain anymore. And that little bit of pain, which turned into a lot of pain, turned out to be a tumor, which would be cancerous. And we would take care of them to the end of their days. This is a common story, especially in northeastern Pennsylvania with our elderly. They wait too long, they stay home because they don't have the money to go to the doctor. They don't have health insurance to get taken care of properly. We need health care reform. We need public option because we do have the working poor out there who can't afford the insurance even though they're working. And that's the reason I stand before you today and ask you to stand with the rest of the United States supporting health care reform with the public option.
Thank you. That was Deb Vonner from the Nurses Alliance. Thank you very much, Deb. That's very heartfelt.